Great day everyone, my name is Erica Sigue. So now, let's discuss what is EEG. So EEG stands for electroencephalography, which is records the signal wavelengths and connect into the computer screen, which determine if the person have epilepsy, if the person have injury, brain tumors, determine if determine if there is part of the brain that not work properly, hemorrhage, dementia, and also for the coma patient or what is the level of the function if you have coma. So, now let's talk about what is the parts of the brain or the anatomy of the brain. Yan. So, we have the frontal lobe which is for motor control. And we have the parietal lobe with sensory touch, pressure, pain, yan. We have the occipital for visuality. And we have the temporal for auditory system or what hearing sound like that. So, now let's move on what is the 4 types of waves. So we have the beta, which is test in parietal and the frontal and parietal lobe, which is determine the alertness for some focus problems or solving problems. So we have naman the alpha, which is found in the normal people, which is the calmness and also the relaxed state. So we have naman the theta. So next, the theta waves, which is for temporal lobe, which is observe daydreaming, drowsiness, and also sometimes they ask question, emotional question to know what is theta waves. Ayan po yung theta waves. Next naman sa delta. So like in theta waves, they also observing the daydreaming and also the drowsiness. But in the babies po ito, which is occurs in deep sleep and also to determine brain diseases, ganyan. This is recorded in the cortex region. So yun. So next, we are gonna talk about the demonstration of EEG tracing and what is the consideration of EEG tracing together with Angela Monique. So yan. Thank you.
So this is the continuation of electroencephalography or EEG. So in electroencephalography, it used to measure abnormalities of the activity of the brain. So for us to get waves or pattern, we record it using small metal discs that places outside the head. This takes 1 to 1.5 hours, and this procedure is painless. Doctor tell the patients almost to be sleepless to get sleep during EEG, that important part of recording. The patient lying must be on bed in 20 minutes or more, but it is commonly 40 minutes. To have accurate result, we have to relax in a whole of time of the test. We need also to measure and determine where electrodes place, and for accurate result, it must be clean. And first, salt base to help the record the signals, and second, we need to electrodes to stay in place and wrap it with a gauze. When we put the electrolytes in the shoulder area for the torque cord, muscle, and heart activities, and we need to turn off the light to have calmness, and after the recording, turn on the lights and clean up with water.